We're also keeping an eye tonight on the looming nurses' strike at Rhode Island and Hasbro Children's Hospitals. The nurses union tells us they plan to vote tomorrow on whether or not to strike, which would begin Monday. We're told neither side met for negotiations today. With less than a week's notice, the hospitals now have to prepare in order to keep operations up and running. Eyewitness News reporter Alexandra Leslie continues our in-depth coverage and explains how it will all work.
We wanted to know more about how a strike would impact you, whether you're inpatient or outpatient. Rhode Island and Hasbro Children's Hospitals continue to prepare for a nurses' strike planned for Monday afternoon.
We are adequately prepared and going to continue to provide top-notch patient care.
Christina O'Reilly, a spokesperson for Lifespan and the hospitals, say the move by the United Nurses and Allied Professionals to strike has put the hospital under an obligation to hire temporary staff, which puts the hospital on the hook for $10 million. In addition, Lifespan says when UNAP strikes, no UNAP employees will be allowed to work the 4 days while temporary employees are there.
Even if it's a 3-day strike, because we're committed to that labor agency for 4 days, so we can't pay for double the labor.
O'Reilly says their goal is to maintain business as usual, including for the patients.
If you're here as a patient on July 22nd and a strike starts on July 23rd, you're going to get the same nursing care that you would have gotten the day before.
Though it's an ongoing situation, Lifespan says it does not anticipate making any significant changes to patient care.
Scheduled surgeries at this point will go forward. We'll revisit those if needed. We will prioritize any sort of life-saving measures always above elected pre-scheduled surgery type things.
Since the hospital doesn't have a dedicated strike budget, that $10 million used to hire replacement workers would come off the negotiation table. Reporting from the control room, I'm Alexandra Leslie, Eyewitness News.